before coming to Kenya, I was practicing in the United States, in California, and in Alabama. So today I'm going to talk about cardiovascular disease for this session today. So our learning objectives, we're going to discuss about the epidemiology and also the etiology of cardiovascular disease. That is the cause and also the burden of disease in Kenya. We'll discuss the risk factors that contribute to cardiovascular disease, how to screen patients for cardiovascular disease, how to treat them with appropriate pharmacologic therapy, incorporation of natural lifestyle interventions for cardiovascular disease, and recognizing the comorbidities and the complications of this disease. So I've seen a lot of this disease in the last 15 years since I've been practicing. In the US, I was in the state with the second highest cardiovascular disease in the country. Nearly 1 out of every 4 adults had cardiovascular disease. So it's something that's very common. It's something that I'm really well used to seeing. And I was surprised coming to Kenya that there was also so much burden of cardiovascular disease. I think before coming, we had assumed that it was primarily TB, HIV/AIDS, malaria. But when we came here, we found that there was quite a large prevalence of cardiovascular disease. So I think that this will be very relevant for you. The chances are that you probably know many people with these problems. So it'll be helpful for you as you are aware of how to treat them and the complications and the disease process. So I want to share now with you my favorite Bible verse, and it's found in 3 John verse 2. Beloved, I wish that above all things that thou may prosper and be in health, even as your soul prospereth. So the focus that we're going to address is not just on physical health, not just on cardiovascular disease, but we want to make sure we address spiritual wholeness, that we have an emphasis on whole person care, because I think that's really the most important thing that we need to be addressing. Last year in 2024, Kenya came out with a second edition that was released for the guidelines of management for cardiovascular disease within the Republic of Kenya. This is something that's publicly available, so you can find this online. You just need to Google it and look at National Guidelines for Cardiovascular Disease, Ministry of Health. It's quite important, and I think that the ministry and the government has picked up on the significance and importance of this disease because they know that a lot of Kenyans are suffering from this problem. The first chapter, interestingly enough, is that they address the prevention of this disease. Usually when we're reading a book, we say that the first chapter and the last chapter is probably the most important chapters. That's what readers usually first read. So the fact that they're putting this as the first chapter means that they want us to pay attention to it, isn't it? The key message says that early detection and appropriate control of hypertension or high blood pressure is the hallmark of preventing atherosclerosis. Cardiovascular disease, CVD, risk assessment refers to the use of a systematic approach to enable identification and classification of individuals who are at increased risk. So it says that the most important thing is to control high blood pressure. So we'll talk more about high blood pressure today. So what is cardiovascular disease? So cardiovascular disease, in the second paragraph, if you can see my pointer, let me see, you'll see that it says it is atherosclerotic cardiovascular disease that results from the buildup of cholesterol plaque in the artery due to deposits of fat, cholesterol, and other substance in the walls of the vessel, which reduce blood flow to organs such as the heart, brain, kidneys, and limbs. Okay? The first paragraph says the majority of cardiovascular diseases are what? Preventable, with control of risk factors, early detection, and prompt management. So atherosclerosis is a big word, and I think a lot of people get confused because it's not really English, it's Latin. So sclerosis means something that's very hard, something that's of a hard substance. Athero means thick, so thick and hard. So atherosclerosis, and cardiovascular means cardiac is heart. Vascular means the vessel, so that's any of the tubes coming from the heart or from toward the heart that carries blood. So this is hardened and thickened heart and blood vessels. And it's because of the cholesterol and the fat that's deposited in there. I'm a visual person, so I usually like to show pictures so I can illustrate the points. So this is a sink that's in the kitchen, and you can see that on the sink, there are holes that's going down into the drain, isn't it? So usually in the drain, it filters out large particles, things that are too big to go down because it will cause a clogging. But small things like oil, water, smaller particles can freely go down, isn't it? But what happens if we have a lot of food and a lot of oil and a lot of water and a lot of different things go down the drain? What will happen? Well, this is going to happen. It's where the drain becomes very clogged with all this grease. You know, a couple of months ago, actually, our drain was not working very well. So I asked our plumber to take a look. I said, "What's going on? You know, is there some issue? Maybe it's blocked with mud or blocked with this." And the plumber took me to the back. He opened this big cover in the hole, and they looked at it, and inside was covered with all the different hair, the debris, the food. And I was really disgusted by it. But imagine this is actually what's happening in your body. This is a real picture of an artery. So what they did was they took the artery, which is normally a round tube, and they cut it in half so that you can take a look at the inside. The first picture in the top left shows that the artery is very dilated, right? You see that it's wider than it's supposed to be. And also in this area, it's narrower than it's supposed to be. So you see that there's different diameters. So there's a narrowing and there's also a widening. So this is a disease caused by the narrowing. So blood is not able to go through the area when it's very narrow. And the other side, you also have cholesterol deposits. You can see the white color among the red. So that white is fat and cholesterol. It's all the lipids, and it's causing narrow so that blood does not go through at a good rate. So why is it important that blood doesn't go through? Well, blood carries something very important called oxygen. And if blood does not go through, that means that our organs are being deprived of oxygen. And oxygen is very important. So if the blood does not go through and the oxygen is being low, then the organs will suffer because the organs need oxygen. So that is what causes a stroke. That's what causes a heart attack. That's what causes kidney failure. That's what causes blindness, is when there's not adequate oxygen because of the low flow rates. So why does this happen, and why do patients develop cardiovascular disease? So we'll talk about the risk factors. So risk factor is something that puts you at a higher risk of having the disease. And with risk factors, there's two types. There are preventable risk factors and non-preventable. So these are also known as modifiable and not modifiable. So modify means to change. It means something that can be changed. What are things that cannot be changed? Well, you cannot change your gender, even though some parts of the world, people are thinking that they can change their gender. You cannot change your age. You cannot change your race and your ethnicity. You cannot change your family, okay? So those are things that are not modifiable. But what are things that you can change? Well, if you smoke, you can change and decide to quit. If you drink, you can change and decide to quit drinking. If you eat fast food, you can decide to stop eating fast food. If you are gaining weight, you can decide to eat less. If you are not active, you can decide to be active. So those are modifiable risk factors. And what you can notice is that there are many more risk factors which are modifiable than non-modifiable. And actually, the modifiable risk factors, the ones that you can change, have more of an impact on your disease. So a lot of people, they tell me, oh, my parents have this disease, my cousins have this disease, it's all in my family. And they say, there's nothing I can do about it. Well, what you can tell them is that there is something you can do about it, because what you do, the modifiable factors, are much more of an impact than the non-modifiable factors, okay? So these are the different components of risk factors. We have social risk factors, we have lifestyle risk factors, we have modifiable and non-modifiable risk factors. And when you have multiple risk factors, then you have a higher risk of developing the disease, which is cardiovascular disease. So whenever I have patients who come to the hospital, they say, but why me? My neighbor, they have high blood pressure. They don't have a stroke. My cousin, she's smoking all the time. She doesn't have lung cancer. My mother, she's had diabetes, but she lives up to 90 years old. Why is it that I'm having this problem? I'm younger. Is it just bad luck? Is it because God has given me dealt me a bad card in my life? And so this is the example I use to show them. I say that imagine that all of us are different cups and different sizes and different shapes of cup sizes. The water that's coming through, let's say the risk factors, even though the risk factors are the same, let's say you have 4 patients who are all smoking, not all 4 of them may develop lung cancer at the exact same time. And that's because of their threshold for disease. Some of them, they may have, let's say, a long existing family history of lung cancer, so they're at a higher risk. So maybe they're the red cup. Or maybe somebody, let's say that their family has never smoked, they've never been exposed to any environmental smoke or chemical toxin, they're at the green cup. So we're all built differently, and our genetics do play a role in that. But if exposed to the same risk factor, we cannot say that all of us would develop the same exact disease. But the risk is still there. And I think that this illustration of the cup and then the water flow rate is helpful for people to understand that we're all different in capacity for disease. Okay? So now that we know what are the risk factors and what contributes to heart disease, it's important for us to know how much of that plays an impact. Like when someone says, oh, this person is a smoker, what's their risk factor of developing lung cancer? Is it 10%, 20%, 100%? This is important because it helps people, I think, with the hard facts and data, because people respond better to numbers when they're seeing the absolute risk for the disease. It's important to know that the disease and the risk is cumulative. One day of smoking is not going to increase your risk of lung cancer. One day of drinking alcohol is not going to increase your risk. But the risk is over a sustained long period of time. So we call this a cumulative disease burden. So the longer you're doing it, that means that you're increasing your risk more and more. And I use another example with my boda drivers. I say people who don't drive with a helmet, they are at a risk for having a head injury. Of course, there are many people who don't wear a helmet and they never hit their head. But with the one day that you hit your head, you wish that you had a helmet on. So the risk is cumulative in that the more that you drive your motorcycle, the more that you take those risks, the higher is your likelihood of getting an injury. So this graph I have here, I hope you can see it. This is a graph dealing with statistics from the WHO on cardiovascular disease. And this is specifically looking at East African countries. So Kenya is there, as well as Tanzania, Zambia, Malawi, Rwanda. So we have all these different East African countries. And this is what they're looking at is the percentage of your risk for having cardiovascular disease. So the number, you see the numbers? The number represents the percentage. So a 70-year-old, this is the age. So 70 years, 65 years, 60 years, okay? So as you go lower, there's younger people. So you can see this, as you go lower, there's a green. Green is usually good, red is bad. So as the color gets darker and darker, it gets worse. Green is good, yellow is mild, orange is medium, red is bad, okay? So if you have a 70-year-old, and this is male, so 70-year-old male who is a smoker, they are at a 30% risk or 38% risk of having a heart attack or a stroke, so some kind of major cardiovascular disease. And the numbers also go higher from left to right. You're seeing that, right? 30, 32, 34, 36, they're going higher from left to right. What is that? That is the body mass index. So that is how big you are. So the more big you are, that increases your risk for having cardiovascular disease. You can see that, right? So somebody who's overweight and who's old and who's a smoker has a higher risk than some young person who's thin, who's a non-smoker. Do you see it? And then also you see on the left-hand side, we have men, and the right-hand side, we have women. Men are higher than women, isn't it? Yes, that's why men die earlier. And women have fewer heart conditions. Now, the reason being, people assume that it's because women have higher amounts of estrogen hormone, and that estrogen may be protective for cardioprotective against cardiovascular disease. We don't know exactly why that is, but that was some theory that people have proposed. Okay, so let's not focus on men and women, but let's focus primarily on the age and on the weight and on the blood pressure. So with this, there's a lot of information in this chart, and I'll share it with you at the end of our session so you can review it more closely. But if you look at this whole entire block that's here, it's for the age group of 70 years to 74 years. As you go from left to right, that is with increasing weight. And as you go from bottom to top, that's with increasing blood pressure. So you can see that having high blood pressure, being big, and being old are major risk factors for having a stroke or a heart attack. So this risk factor is based on having a stroke or heart attack in the next 10 years. That means in the next 1 decade of your life, your risk is going to be 30% if you are old, fat, and a male non-smoker. Okay? So which one is the most strongest risk factor? People want to usually know, like, what is the makes the biggest difference? Of course, it's best if you lose weight. It's best if you don't smoke. It's best if you exercise and keep your blood pressure down. But which one is the most catastrophic one? So out of all the risks, the highest is actually smoking versus non-smoking. So if you can get your patient to quit smoking, that really helps a lot. So that's the number one thing. The second most helpful is the blood pressure. You see, as the blood pressure comes down, the risk reduces by almost half. You're seeing that 30 to 15, 24 to 11. So lowering their blood pressure and then having them to quit smoking helps a lot. And as they lower their blood pressure, as they're reducing their weight, their blood pressure will also reduce as well. So sometimes when you make one or two healthy choices, the others will follow. So as somebody loses their weight, they will also be losing their blood pressure as well. Okay, so this is a chart that you can refer to later on in the future. Okay, next slide. Okay. So what is the way that we treat them? Well, conventional medicine says that we treat with drug therapy, pharmacologic therapy. And there's many, many, many types of different drugs that there are there. For high blood pressure, for cardiovascular disease, there are thousands of them because you may have one drug name, but there's different brand names, there's different combination, there's different formulations, there's many, many different ways of treating them with drugs. But drug is not the only way that we treat them. In fact, the Kenya Cardiac Society and even the guidelines for the Ministry of Health says that the first line should include non-pharmacologic therapy. You're seeing that? So non-pharmacologic means without drugs. So treating without drugs. I found this very interesting because I didn't expect Kenya to be a proponent of lifestyle and non-pharmacologic therapy because there's so many chemists around and my patients are always asking for free drugs. So I was a bit surprised when I found this. Maybe some of you are surprised too, maybe not. But I was surprised that the guidelines had advocated a heavy preference toward non-pharmacologic therapy. Let's read what it says. It says that non-pharmacological interventions are largely lifestyle interventions. Graded lifestyle advice is appropriate for everyone and needs to consider the individual circumstances. Specific lifestyle interventions are based on behavioral counseling approaches. So they talk about diet, activity, temperance, and all these other things that we know very well. So the first is diet. An unhealthy diet is characterized by high salt intake, low fruits, low vegetables, high fat, high sugar. So this is not surprising for most people. I think now many people are aware that high fat, high sugar, high salt is bad for us, right? Yeah. The second recommendation for non-pharmacological or lifestyle is for physical activity. Physical activity that everybody should be active. It's very protective for the cardiac, and physical inactivity is a high risk factor. So this is a chart of different types of physical activity. There's light activity, just as light household work, walking, moderate physical activity, such as moderate brisk walking, and vigorous activity, such as running. And this is a chart showing how we can counsel our patients so that they may be able to quit smoking and quit drinking. So it goes to the 5 A's: the ask, advise, assess, assist, and arrange. So following this algorithm will yield a more likely success rate for people who wish to quit smoking and drinking. Okay. Okay, so we have to also talk about pharmacologic therapy, which is drug therapy. So later on, I'll talk about whether drug therapy is good or bad. I think that's something in Kenya we have a lot of questions about. You have all these medical missionaries, they're talking about don't take any drugs. If you use drugs, that means that you're not faithful. That's not God's way of healing. If you use drugs, it's not, you're not having faith, you're not doing this and that. So we'll talk more about that. But I just wanted to show you that, this one major drug type, it's called lipid-lowering therapy. And what lipid-lowering therapy does, sorry, my kids got the flu, so they got me sick yesterday. So lipid-lowering therapy is exactly what it says. It lowers the lipid. It lowers the fat in the blood. And it lowers the fat when the fat is high. But let me ask you this. If you don't eat fat and you don't take in external fat, then will your body fat level still be high in the blood? And the answer is no. If you don't drink or eat or intake any fat, then your blood levels fat will be low. Of course, there's many types of fat. There's every fruit and vegetables has some significant amount of fat. You just need to look at the mangoes, the beans, the peanuts. All those have fat. But I just wanted to help you mention that lipid lowering specific cholesterol is a type of lipid or a type of fat. And cholesterol is only found in the meat of animals. So it's only found in flesh. So if you don't take flesh, then you won't have any cholesterol at all because plants do not have cholesterol. There are no cholesterol in plants or vegetables or fruits. So a lot of these drugs are targeted toward cholesterol. So if you don't eat any animals, theoretically, you don't need to take drugs to lower your cholesterol. Okay? And cholesterol-lowering drugs do have side effects. So some people may not be tolerant of them. And then you just always have to assess with your patient and say if they have any side effects, is it worth even starting them on a drug that they have a compliant with? Okay? All drugs have some potential side effects that we need to counsel our patients on. Okay, chapter 2. Recall that we said earlier that early detection and appropriate control of high blood pressure is the hallmark to prevent disease. So if we control high blood pressure, it'll help a lot already for controlling controlling cardiovascular disease. So is high blood pressure a problem? Yes, it is. According to the World Health Organization or the WHO, approximately 1.3 billion people have high blood pressure. So how many people are currently in the world? We have around 7.9 or 8 billion people in the world. So 1.3 out of 8 billion, that's like over 15%. And this number is probably grossly under-exaggerated. The reason why is being that there are many people who don't know what their blood pressure is because we don't check them. So we could even make that number higher and say that it's probably 20%, or it's probably 2 billion people that have high blood pressure. But look at the numbers. Out of all those people with high blood pressure, very few people are actually being treated, and the people who are on therapy, their blood pressure is still not under control. So that means that we're not doing a good job screening for our patients, and we're not doing a good job controlling blood pressure in our patients. And this is relevant not just for the rest of the world, but because Africa has higher blood pressure than any other continent in the world. So it's very, very high in Africa. The risk factors for high blood pressure is the same thing as the risk factors for cardiovascular disease. Physical inactivity, tobacco use, exposure to alcohol, unhealthy diet, overweight. High blood pressure is the most single risk factor for cardiovascular disease. So what do people usually present with? When people are having high blood pressure, what do they feel? I think a lot of people associate high blood pressure with a headache. They say, oh, I'm having a headache or I'm having a chest pain. But the reality is that most people don't have any symptoms at all. They don't feel anything. And when I say most, I do mean most. I mean like over 90% of people with high blood pressure, they don't have any symptoms. And it makes sense if you think about it. If people had symptoms when their pressure is high, then they would probably go to the hospital more often and they would screen them. But we know this isn't the case, and many patients are going unscreened and they're being untreated because this disease is undetected. The reason why it's undetected is because our patients don't have symptoms. That's why a lot of diseases, such as like cancer, high blood pressure, they go undetected for years because they don't have very obvious symptoms. So high blood pressure is also called the silent killer. Silent because we don't know that it's affecting us, we don't know that it's attacking us, and it just kills us all of a sudden, even though we've lived for a long time. So next time you look at somebody with high blood pressure, don't assume that they just developed it that night or that day before, but they've probably had it for a very long period of time, but it was chronic and uncontrolled. Okay? So high blood pressure, how high is high and when is it too high? So blood pressure deals with numbers, and it's exactly as in the name. It's the pressure of the blood inside a blood vessel. So is blood pressure bad? Well, so people everywhere says that it's bad, but actually you need blood pressure. Let me give you an example. Let's say that you're watering your garden and you're using a hose and you're trying to reach some of the vegetables on the side. Let's say that your land is a square and you're on one side of the square, one edge of it, and you're trying to water your garden and you're getting rid of it. So you don't need a lot of high pressure in order to water the plants next to you. Let's say you have some sukuma that's right next to you and you're trying to get them watered. You don't need high pressure because it's close by. But let's say on the other side of the field, you planted something like kunde or you planted some other kind of Kenyan vegetables and you cannot reach it with the water. So what do you do? Well, what you do is you put your finger over the opening of the water hose. And what this does is it increases the pressure so that the water can go further, right? Yes, I'm sure people who have watered the gardens, they've done this. So, is it bad for you to plug up the water to make the pressure go further and further and away from you so that you can water the garden? No, it's not bad because without that, then those vegetables at the end, they would turn brown and they wouldn't grow. You wouldn't be able to get good green vegetables. So pressure is necessary because you need it to reach the places that are far and hard to get to. So that's the same thing with our body. Pressure is there for a reason. Pressure is there so that the blood can go further away. If the pressure was low, the blood would not go very far and it would stay stuck around the heart. But we need it to go far because we need the blood to go all the way up to the brain against the gravity. We need the blood to go all the way to the toes and our feet, which is very far from the heart. So that pressure is actually quite important and very, very important so that we get circulation. But what happens if the pressure goes too high? Let's say that when you're watering your garden, you push down really, really hard and you make the opening really small. Then what happens is that the water goes very, very far and your plants don't get any water at all. And in that case, your plants would still die. And that's exactly what happens in the body. When the pressure is too high, it causes issues with the organs because they don't receive enough oxygen. Okay? I hope that's a little bit easier to understand for non-medical people. So what is too high and what is high? Well, we use numbers, and the numbers are millimeters of mercury, which is a unit of pressure. So normal is anywhere between less than 120 and less than 80. Anyone who has above that, we say it is elevated. Anyone who has above 140 or above 90, then we say they have stage 1 or grade 1 high blood pressure or hypertension. And then if it's very high, above 160 or 110, then we say they have grade 2 hypertension. And then grade 3 is over 180. So there's different grades because the higher it is for longer periods of time, the faster it is that you'll get some kind of an adverse event, like a heart attack or a stroke. But remember that we said that the risk is cumulative, which means that it happens over a long period of time. So if you have high blood pressure that's very high, like 170s, 180s over 10-year period of time. Yes? Okay. So the lower is better if the patient can tolerate it. So we're seeing that higher is worse, lower is better. Okay? I think that's the end point, is that you want to get it as low as we can tolerate it. Okay? So at every clinic visit, patients should receive advice about lifestyle because healthy lifestyle choices reduce blood pressure. Okay? And it also reduces the number of drugs that are required by the patient. So at every visit, you should always address this and ask, are you smoking? Are you drinking? Are you physically active? Are you eating lots of fruits and vegetables? All those questions should be assessed every time for high blood pressure. We call that a lifestyle history when we're taking a history and physical exam. This is what we do for blood pressure treatments and the target. If it's elevated, we check it again. If it's still elevated, we address it with lifestyle, we treat them. So here's an algorithm I think that would be helpful. A lot of us focus on algorithms and treatment decisions based on this. So let's say that they have high blood pressure. They have it. The first thing we do is lifestyle advice. And by the way, this is all from the Kenya Cardiac Society or the Ministry of Health for the guidelines, okay? So the first thing we should do is lifestyle. If the blood pressure is grade 1, where it's 140, and then the patient is not at high risk, then we do drug treatments after 3 to 6 months of lifestyle counseling. However, if it's very elevated, grade 2, we still do lifestyle counseling, but we implement drug therapy for the patients. Okay? So this is an algorithm that the Kenya Cardiac Society and the Ministry of Health has implemented. So this approach is actually quite conservative if you're looking at it, because it's saying that a patient whose blood pressure is 140 over 90 can delay treatment. And I think that, this is a personal decision. It's personal between patient to patient and between provider to provider. Some patients, even if the blood pressure is 180 or 200, they still don't want drug therapy. Some patients, even if it's a tiny bit elevated at 130, they'll immediately start taking tablets. So, every patient is different, and some of them are really pro pharmacological therapy, some of them are against it. So you need to have a discussion with each patient because they're different and assess their readiness to start medications. But lower is generally better. So, what is the cornerstone or what is the hallmark of high blood pressure? And it is typically drug therapy. And drug therapy has been there for many years. It's very lucrative, it's very profitable. Like these chemists make lots of money. That's why when you're going around Kenya, you can't go within a few hundred meters and then you're seeing a chemist. If you're in Nairobi, it may be even like a few dozen meters. There's chemist after chemist. I think there's sometimes even chemists right next to each other. There may be 4 buildings and they're all different pharmacies and chemists. So they know that this they sell drugs because they know that it's very lucrative. People buy this stuff and people, they make money off of it. And unfortunately, because so many people have high blood pressure, they know that there's a lot of people seeking drug therapy. And there's lots of different types of therapy. I told you already, there's more than 500, 700 different types of drugs, combination of drugs, brands of drugs, formulations of drugs. You can find anything under the sun now. So the next algorithm I'm going to show you is how to use the drug therapy. So we have these algorithm for which drug to start with. So typically what we recommend starting is a combination drug therapy. So combination because the 2 drugs that work together are more effective together rather than starting one single one alone. And usually the dosages for the combination tablets are a bit lower, so you don't need to worry about too strong of a dose. You can always increase the dosage later when they're not meeting the target. So the first drug is called calcium channel blockers. So those are amlodipine, nifedipine, felodipine, anything that ends with PINE. Thiazide diuretics include hydrochlorothiazide. And then we have ACE inhibitors, which include lisinopril, lisinopril, captopril, and enalapril, anything that ends with PRIL. And then the ARBs, which is losartan, candesartan, valsartan, lumisartan. Those are anything that ends with TAN. So you know which kind of drug they are depending on what the ending of the name is. So if you memorize the name, the last suffix of the name, then you're able to know what class of drug it is. So step 2 is if they're still high, the blood pressure is still uncontrolled, then you do a higher dose combination. So you increase that from 1 tablet to 2 tablets. Step 3 is that we add a third agent. It's called triple combination. Okay. So this is the typical, very standard way of treating blood pressure. You start them on drugs. If it's not effective, you increase the dose. If it's not effective, you add on another one. You just ongeza, and you add a different one. Okay. And I think that's not unfamiliar with people. You're used to it and you understand that's how it is. So which one is the best treatment? What is the best drug out there? There's so many drugs, and my patients are saying, yeah, there's many drugs. Which one is the best one? And I tell the patient, I say, the best drug is the one that you are compliant with. The best one is the one that you can afford. The best one is the one that you're able to tolerate. And the best one is the one that you can remember to take. Even if they spend a lot of money for the drug, if they're not taking it, it's not going to help them. If it's sitting in a pill bottle on the counter, it's not going to help their blood pressure, right? Yeah. So when you're assessing whether a patient needs drug therapy, always ask about their financial status. Are they able to afford this? Are they able to sustain this for a long period of time? Can they tolerate its side effects? If you know that your patient's non-compliant, maybe instead of giving them a tablet that they need to take twice a day or 3 times a day, use something that's easier so that's only once a day. If they cannot take multiple tablets, maybe you can try to find 1 tablet that's combination. Unfortunately, however, the combination tablets are generally more expensive because you're paying for the convenience. So if you want them to save a lot of money, they don't have money, the cheapest is taking separate medications multiple times a day. So unfortunately, if they're able to, they can afford it, the most helpful option is the combination tablet that they only need to take once a day. But is drug therapy the only thing that we have? And the answer is no. I think as Adventists, I assume that many of you are Adventists since this is AMEN, Adventist Medical Evangelism Network. We know that there's something more than drug therapy. We can treat with God's method. And this is where I'll spend a little bit of time talking about whether drug therapy is something that we should be focusing on. Did God create drugs for us to take? We know that's not true because he didn't go to a chemist and create these tablets. But even though God didn't create it, is it bad for us to take it? Is it his will for us to be dependent on drug therapy? So I'm going to share with you some quotes, and then we're going to discuss a little bit in the future at the end of the session as well, and we can have an open discussion with question and answer. So I wanted to share with you some quotes from Ellen White about drug therapy. She writes that we should train the people to correct their habits and healthful practice, remembering that 1 ounce of prevention is more valuable than a pound of cure. Lectures and studies will prove of the highest value. That's from her selected messages. The next quote is seldom needed, use them less and less. She says, drug medication, as it is generally practiced, is a curse. Educate away from drugs, use them less and less, and depend more on hygienic agencies. Then nature will respond to God's physicians. Pure air, pure water, proper exercise, clear conscience. Many would recover without medicine if they would obey the laws of health. Then lastly, she says, strong drugs need not to be used. The first labor of a physician should be to educate the sick and suffering into the course that they should pursue to prevent disease. The greatest good is done by trying to enlighten the minds of all we can obtain access to, as to the best course for them to pursue to prevent sickness and suffering and broken constitutions and premature death. Those who do not care to undertake work that taxes physical and mental powers will be ready to prescribe drugs, which lays a foundation to the human organism for a twofold greater evil than they have claimed to have relieved. So what is she saying? Is she saying drugs are bad and terrible? Well, okay, she's not really saying that. What she's saying is that drug therapy is not needed if we were to educate our patients and they were to remove the cause of their illness. Like I said earlier, if patients don't take any fats, like they don't take meat and animal products, they don't need a drug to lower the cholesterol in their blood because the cholesterol wouldn't be there. So I usually tell my patients, I say, you can continue eating what you're eating and take this drug to counteract the effects, or you can stop eating meat and then you don't have to take this drug because you won't have a higher risk. And patients respond differently. Some people, they're aware and they still are they're unwilling to do it. Some people are unaware and they're willing to try, but usually people are aware and they're unwilling. So I think, if your patient is aware of what they should be doing but unwilling, that requires a different approach altogether. So drugs are life-saving, and we know that they can help with acute episodes of illness. But the biggest issue I have with drugs is that it promotes dependency on the drugs. When someone knows that they're going to be taking medications and it's going to be controlling their pressure, they're not likely going to be changing their lifestyle. It's easy to pop the tablet and use that every day. And then they'll say, I can just continue eating what I'm eating, continue just not exercising because I just take this tablet instead. And I think that's kind of the human nature. It's our sinful human nature in our mind, thinking that we can continue living how we want to and not suffer any consequence. That, we can just continue living in sin. And I'm going to give you an example. So after I came to Kenya and we started driving, we started getting stopped by the policemen. The first time I was stopped, I was speeding. I was going fast. It was on this road. I think it was near, where was I? I was driving between Nairobi and Kisii. It was a long stretch of road and there was no car, so I was going fast. And the police officer stopped me. They said, you're driving too fast. You need to come in and you have to pay a fine. I said, I'm very, very sorry. How much do I pay for the fine? And they said, oh, just give me like 1,000 shillings or something. I said, okay, fine. Here's 1,000 shillings. I'm very sorry. And then they let me go. And after they let me go, I realized, I said, I think I just paid off a police officer for speeding because they just took my cash and they pocketed it. I didn't think about it at the time because I thought I was paying for a fine. And then later I was talking to my friend, and my friend said, if they were really giving you a ticket, they should have been a receipt and you should have submitted payment through an official means. They wouldn't have taken cash. They would have taken a pay bill number. They would have wrote down your details, all those things. I was like, wow. So I literally just, I didn't know it, but I guess I bribed a police officer so that I could, get out of a ticket. But okay, when I went home, everything was fine. The next time I had to go back and drive back to Nairobi, and I passed that place again. And I was thinking, normally I would be driving a little slower. But last time I got away with it. I was saying, last time I was driving fast and I paid 1,000 and I was able to just go on my way. So maybe this time I'll just drive fast and I'll pay 1,000. I mean, if I get caught, I'll just pay a little bit of money and I'll be fine. You see, that's exactly what it means to live in sin. Instead of seeking forgiveness and being remorseful that I was speeding and that I was stopped by an officer, because there was an option for me to pay off the police and give them some small money. Now I'm always going to be speeding because I know that there's no consequence that cannot be removed. Are you getting what I'm saying? So I think that's the problem with drugs, is that when patients know that drugs are there to help them with their pressure, they don't really feel motivated and incentivized to decrease their risk factors. A lot of people are not very motivated. They say, well, if I have a medicine to lower the fat in my blood, then I don't need to stop eating meat. I can just eat whatever I want because this medicine will help me with that. So I think that's why Ellen White, The Spirit of Prophecy, and God tells us about drug therapy and its harms. Okay. So she further writes, pure air, sunlight, temperance, rest, exercise, proper diet. So this is New Start. Trust in divine power. These are true remedies. Every person should have a knowledge of these agencies and they should know how to apply them. It is essential both to understand the principles involved in the treatment of the sick and to have a practical training that will enable one rightly to use this knowledge. The use of natural remedies requires an amount of care and effort that many are not willing to give. And this is very true. I mean, think about the last time you went to a clinician, when you went to the OPD, when you went to the hospital. They spend 2 minutes with you, your blood pressure's high, they write you a drug. You tell them you have pain, they write you a drug. It's literally just a few seconds of question answers and they write drugs. How often do they really spend time with you and talk to you about all the symptoms you're having, going over lifestyle and counseling you and educating you? It's difficult, because if you're seeing like 50 patients, 60 patients, and you're spending 10 minutes with them, that's already 500 minutes, So there is a limitation on that. But if you want to have long-lasting and impactful counseling, you need to spend time with them. And that's why Ellen White says that it requires care and effort that many are not willing or able to give. Nature's process of healing is gradual, and to the impatient, it seems slow. The surrender of hurtful indulgence requires sacrifice. But in the end, it will be found that nature, untrammeled, does her work wisely and well. Those who persevere in obedience to her laws will reap the reward, health of body and health of mind. And it's true. It's not easy to give up things that we don't want to give up. It requires sacrifice. But what are we giving up? We're giving up hurtful indulgences, things that are harmful for us. People who love to drink, it makes them feel good, who loves to smoke, who loves to do this, they don't want to give it up. And it requires a lot of sacrifice. So that's why it really needs heart effort, and that's why it really needs really deep counseling. So I usually tell my patients that I reason from cause to effect. They're saying, give me this tablet, give me this drug, and I usually educate them. I'm telling them drugs is not fixing the disease. If you have a severe headache and your headache is from malaria, what good is it if I just keep giving you Panadol without treating the malaria, right? So I teach the patients, I say, we must reason from cause to effect. And look at this man. He's in the middle of a lake and his boat has water in there. He takes this bucket and he's just scooping out water. He's emptying and emptying. Is that going to fix the problem? No, because you see behind him, there is a hole in the boat, right? There's a hole that's leaking and causing water to come in. So the first thing we should do is plug the hole. We need to stop the water from coming in. Then after the water stops coming in, once we empty the boat from water, it will stay dry. So this is what I usually tell the patients. I say, I'm not here to just get water out of your boat. I'm here to plug up those holes and patch and repair your boat so that the leaks will be prevented, so you won't have to keep getting water out. Okay? So the next few minutes, I'll talk about how we can plug up the holes and how we can patch up and repair our boat. So high blood pressure and cardiovascular disease. What we eat is directly related to our disease or our health. So red meat, fish, processed meat, sugar, drinks elevates the blood pressure, and then whole foods and natural grains, vegetables, fruits lower the blood pressure. Soda increases blood pressure. People who have any more than one drink, they have higher risk of high blood pressure. And likewise, people who drink more water have decreased risk of high blood pressure or decreased risk of fatal heart disease. So this is not surprising, right? I mean, sugar is not good for you. The water is good for you, so this is not surprising. So how much water is enough? People say, "Oh, I drink water. I drink 1 cup. That's enough, right?" Well, not really. So the amount of water really depends on the proportion of your body surface area, and then your weight. Because bigger people need more water, smaller people need less water. But if you look on average, the average person requires at least 6 to 8 glasses. Anything more than 8, 10 glasses, you have a plateau there where the significance is not very high. You can see that, right? You can see that over here. Anywhere from 6 to 8 is helpful, and anywhere if you go further 8 to 10, your benefit is not significant. Okay, but the greatest benefit is from 2 to 6. You see from 2 to 6 is a greater benefit. Okay. Exercise also helps with blood pressure. Exercise reduces the weight and then it helps with the blood pressure. Exercise also reduces the blood pressure because it helps with your heart, keeps it healthy. So how much value does lifestyle have on blood pressure? Well, if you want these measurements, it can tell you. Weight loss. For overweight patients or obese patients, 1 millimeter of mercury is reduced for every 1 kg of weight loss. That's significant, isn't it? So if your blood pressure is 140 and you reduce 10 kgs, you can reduce your blood pressure by 30, isn't it? Diet. A diet rich in fruits and vegetables, whole grains, can decrease the blood pressure up to 10 millimeters of mercury. Sodium restriction can reduce it by another 5 points. Exercise, reduce it by another 5 to 10 points. Okay? So if you add all these together, you'll have normal blood pressure. You won't have elevated blood pressure. So these things are really helpful, okay? What's the problem with blood pressure? What happens if the blood pressure remains untreated and it's very high? Well, it damages the different organs. It causes stroke, meaning that it cuts off the supply of oxygen to the brain. It causes blindness because it cuts off oxygen to the eyes. It narrows and hardens the arteries in the eyes. It causes diabetes. It causes kidney failure and dialysis. Actually, in our region, in Homa Bay, we have a lot of patients who are on renal replacement therapy or dialysis because of high blood pressure. In the heart, it causes heart attack and it causes heart failure. Okay, so these are all complications that you won't want to develop when you have high blood pressure. When someone develops a stroke, it's already too late. When someone is on renal failure and they're on dialysis, it's already too late. And I think that a lot of patients, they feel regret, but only when it's too late. A lot of patients, they say, "Oh, I wish I stopped smoking," but they only say that after they're diagnosed with lung cancer. So, unfortunately, I wish we could say that there's always a time when we can reverse it. But just like the ark during Noah's time, when the ark door was closed, unfortunately, God had closed the door. So there is a time that we must say that this is it. It cannot be reversed anymore. And I'm sorry, but there's no other option. Yeah, that's how it is. But I do want to share something with you that's a little bit uplifting and encouraging is that coronary disease and some cardiovascular disease can be reversed. So remember what Ellen Wright wrote. She said that the disease, it takes a long time, right? Like people are not patient enough. Usually people don't want to wait. They don't want to put in the work. And this is true. So somebody with coronary disease, if you can see this photo, you see that this artery here is very narrow, right? It's small. Do you see that? Like up here is the beginning and the blood is flowing down. You see my pointer, right? So as it's going down, it gets narrow here in the distal LAD, the left anterior descending coronary artery. But if you look that after lifestyle medicine for 3 years, like let's say they reduce this is a patient who stopped eating any animal fat, who started exercising, who started drinking water. Look what happened. Same patient 3 years later. This artery opened up and they're having better blood flow and better circulation to their heart, right? So Coronary disease, artery disease can be reversed, but it requires patience. Okay, it took 3 years for this to happen, and he had to be really consistent with his lifestyle changes. And I think that's something that we need to encourage our patients. You know, a lot of the times the patients come and see us, and we're always telling them what they're doing wrong. You're smoking, you need to stop. You're eating this, you shouldn't be eating this. It's bad for your sugar. You're very overweight, you need to lose weight. You're not exercising enough. But you know that patients get discouraged, and we need to give them hope. You know, our job is not necessarily just to tell them what they're doing wrong, but our job is to tell them how they can be helped, right? And this is a verse that I like to share with my patients. It's found in Second Chronicles 7:14. It says, "And if my people who are called by my name will humble themselves and pray, seek my face, and turn from their wicked ways, then I will hear from heaven and forgive their sin and heal their land." Or in this case, he will heal their hearts. He will heal their blood pressure. He will heal their diabetes and heal their whatever they need. You know, God is very merciful, and he gives us many, 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 many chances. Think about it. You have people who have high blood pressure, who have diabetes for 10 years, and then later on they develop a severe foot infection and they chop off, we have to amputate their foot, right? And God is saying, you know, I start with a toe. I start with a small toe, and then it moves up slowly, slowly, progressively. He could have made it so that our entire foot just gets disease and we have to remove it. But he's merciful because he does it slowly by slowly, because he wants us to repent. He wants us to stop with our bad decisions, you know? And I think that shows that God really wants us to be healthy. And when we don't choose to be healthy, it makes him very, very sad. His eyes are full of tears when he knows that we're doing something to hurt ourselves when we could be doing something to help ourselves to stay healthy. So when you're dealing with a patient who's dealing with these chronic illnesses or cardiovascular disease, just realize that they're sinners and they're in need of God, because only God can help them from their sins and their self-control. Okay? So as we finish, I just want to summarize what we discussed this evening. Cardiovascular disease encompasses multiple disease states. It has heart failure, it has stroke, it has high blood pressure, etc. The most common presentation and symptom is there is no symptom. That's why it's so important for us to check and screen everybody, because people can walk around feeling fine but not know that they're sick. I think there's also a very good spiritual lesson for this. Many people walk around, they say, I feel fine, I'm not a sinner, I'm a Christian, I don't drink, I don't smoke, but they don't realize that we're all sinful, right? Cardiovascular disease is common, and if left untreated, leads to death or permanent disability. And screening and counseling is a key priority for prevention and control. Pharmacotherapy should take into account the side effect profiles and comorbidities, and if the patient can afford it and able to take it. Implement lifestyle changes with each patient at every visit, which is not only preventative, but also can help with the reversal of disease. Okay, so I'll stop there. And I'll ask you if you have any questions that you want to go over, and we can have like a brief, I think 5 or 10 minute discussion. Okay? Any questions? I know that was a lot of information. If you don't want to speak out loud, you can also type it on the side comment um, so other people can see as well.
Hello.
Hi.
Would you recommend any certain diet or a certain diet for diabetic patients?
Yeah, that's a very, very good question, but it's a very loaded question. You know that there's so many different diets out there. Everybody has like and everybody's very loyal to their diabetic. We have Mediterranean diet, paleo diet, vegan diet, pescatarian diet. You know, where I'm here in Luo land, it's pescatarian. You know, they eat fish diet. So there's many different diets, and I don't have time to go through all of the ones that compare, but I'll give you some resources. One is that it's called the Adventist Health Study, AHS, and they've been monitoring people's diet and their lifestyle now for like 30 years. And what they've done is they say which diet is superior, which one helps people live the longest. And it's found that the best diet is a whole foods, plant-based diet. So what is whole food and what is plant-based? Whole food means that we take the food as it is as a whole and we don't process it. So the best thing is we take the grain and then we do minimal processing. So instead of taking the wheat, removing the outside, then making white bread with a whole wheat, we just take the whole wheat as it is, and maybe we just minimally process it just by milling the whole grain and using that. So that's whole wheat, whole grain, and plant-based. Plant-based is anything that grows in a tree, that grows out of the ground is plant. So anything that God has created, we usually say is very good. In Genesis, after he created each day, he said it's very good, right? Yeah, so if God says it's good and he created it, that's good, then it should be something that is good for our body. So anything that grows out of the ground, anything that's from a tree, anything that he has created is good for us. So that's the kind of very simple way that I would say for the diet. So people say, oh, don't eat fruits because it has sugar. But if God made it, then it's okay. And it's very funny because people who take lots and lots of fruits have lower risk of diabetes because fruits have a very protective phytochemicals and vitamins and nutrients and fiber that's protective against diabetes. So whatever God made is good. We have lots of questions on the side. There's a question on health reform. So health reform is important, but health reform for the sake of health is not typically what we're after. If I wanted people to be, there are lots of people now in the world who are not even Christian, like they're Muslims, they're Hindus, they're being healthy because they want to live longer. But the goal that we as Christians and Adventists have to live long, to be healthy, is because we believe our body is God's temple, and we want to take care of our body because it's a way of stewardship, right? So health reform for me is not so much I'm trying to live as long as I can, and I'm trying to, just like be healthy, but I want to have a clear mind because we know that there's a very, very strong relationship between the mind and the body. And if the body is healthy, then the mind is able to be more receptive to the spiritual truths. One way that Daniel was able to resist temptation and that people were able to draw closer and Jesus was able to get closer is because the body was in line with the spirit. So I think that health reform, a lot of the times we say, oh, health reform, dress reform, education reform, speech reform, everything is reform. But the true purpose of that reform is that we should become more spiritual. So let's not get off that focus. What is the impact on sleep quality and cardiovascular disease risk? There's a huge impact of sleep quality and cardiovascular disease. So you can Google sleep hygiene and cardiovascular disease, and it tells you all these sorts of things. People who don't sleep enough hours, who sleep very late, who have interrupted sleep and they're waking up frequently, they die earlier because they have a heart attack. And if you look at people when they usually die, so heart attacks usually occur in the middle of the night when someone is asleep. And the reason being is because in our blood, we have a hormone called cortisol, which is a stress hormone that is elevated and lowered throughout the period of time. And people, when they're sleeping, they have higher amounts of growth hormone and cortisol that's being elevated. And that's why it impacts also our heart. So if you notice that people are dying in their sleep, it may be from their heart defects. So try to get good sleep quality on cardiovascular risk disease. People who also don't sleep enough have higher blood pressure as well. Any other books for reference? So if you want medical books, there's thousands and thousands of medical references. But you have to remember that with medical literature and with scientific data, people are changing all the time. That's why we have updates. I showed you the Kenya guidelines for cardiovascular disease that was edited in 2024. But do you remember when the first one came out? It was actually, I think, 2021 or 2020. So, medical literature is always being updated every year, every 2 years. So you always want to make sure that you're reading the most updated one. As far as other references, reading Spirit of Prophecy is very helpful because that doesn't change with the time. What Ellen White said over 100 years ago is still very relevant now. All the things about smoking and drinking, exercise, that's even now scientists are beginning to discover that what she said was true. So any Spirit of Prophecy books are very helpful. Yeah. So any other questions?
Excuse a
Yes.
patient having a kidney failure. So, how can we help this patient? Remember, he's okay. Like he's undergoing. He has a nini blood pressure. Yeah.
Yeah. So kidney disease is in stages. So usually when it starts out in stage one, they're still able to make urine. The short call is still okay, but maybe their filtering function and their kidney function is decreased and diminished. So what we will want to do is prevent the progression of kidney disease because there's stages of kidney disease. And when it gets to stage five, like last renal failure, it's generally irreversible and they have to be dependent on dialysis and they're not able to make any urine at all. So what we want to do is prevent it before that so it doesn't get worse. And you can stay stage one for many, many years. I've had some patients who are stage one kidney dysfunction for maybe 30 years, 20 years, and they didn't progress because they had a good lifestyle. And if you have early stage kidney disease, it's more likely to be reversible, which means that if you change the lifestyle and if you remove the thing that's causing the disease, it's more likely to be cured. But the problem with that is that if once they start slipping back into their old ways and then, if they feel fine now and they start doing the bad things again, the disease will come back again. So the disease is never 100% cured, but you can just say it's in remission. Technically, if we use the word cure, it means that this disease is gone and it will never come back again. But we just use the word controlled because whenever, let's say that you stop smoking, then that means your risk for cancer is low. But if you were to restart smoking again, then your risk would come back and the risk would be elevated again. So it really depends on how you are doing going forward. Another question we have is why is sometimes the heart rate beating very hard and fast, even when someone is resting and sleeping? So that term is called palpitation, when the heart is palpating, when it's beating fast and you're aware of the heartbeat. So that is not usually normal. And for that, patients usually need to undergo some investigation. They should do an ECG to check with the rhythm of the heart to make sure that the heart is not abnormally beating fast. They measure the rate and they measure the rhythm of the heart. It might be irregular. And then if there's some abnormal with the structure, like let's say the heart is enlarged, or there's a valvular issue or a structural deformity of the heart, then that needs some further investigation. There's many different causes. It can also be hormone imbalance, like let's say their thyroid hormone is also unbalanced. It can cause that too. So it requires some more investigation that we cannot do without more, tests and history. Yeah, good questions.
Hello.
Yes, yes.
By avoiding when I go vegetarian and avoid certain animal meals, wouldn't I miss on certain nutritional benefits coming from animals?
Yeah, so that's a common thing that people, many they always say. They say, "I'm not going to get enough protein. I'm not going to get enough vitamin B12. I'm not going to get this and that." And I think that that propaganda has been there because a lot of people don't want to give up meat. So sometimes when we like doing something, we kind of will give excuses that we continue doing it. I had this polygamer who was at my hospital, and I was like, "You probably shouldn't keep taking on more wives. He's on his fifth wife." He's like, "Yeah, but the Bible says it's okay. Abraham had this, or Moses had this, or Solomon had this," and so they use all these examples. So what I wanted to share is that you know the thing that you're mentioning, it's not that you're going to miss anything, because if God created it and he says it's good, then he wouldn't promote that kind of a lifestyle and that nutrition if it was lacking. So the only caveat is that you need to eat more variety. So people who only take in plants, they need to have a variation of plants. You cannot just eat sukuma nugali every single day of the week. You need to have also different types of beans, different colors of beans, different types of fruits. But as long as you eat everything, you won't be deficient in anything. So that's what the only recommendation I have is that if you provide a variety of food types, then you'll be okay. And then another question is, what causes the heart to enlarge? So there's also many causes for enlarged heart. Sometimes infection can cause enlarged heart. For example, if TB or a virus gets into it and it attacks the heart, it causes inflammation, which makes the heart enlarged. Sometimes the heart is enlarged because when there's high blood pressure, then the heart has to pump against the pressure. It weakens the heart and it makes it enlarged. That's the most common cause of heart enlargement in Kenya, is when the blood pressure is not controlled well and the pressure that the heart has to push and squeeze out against is very, very narrow artery. It makes the heart work harder, and then it enlarges it because it gets more and more weaker and weaker. So that causes heart enlargement too. Okay. Well, thank you so much for having us. I had a really nice time sharing with you, and I hope that you were blessed as well. Let's close with a word of prayer. Father in heaven, thank you for giving us this session together as we learn about health. Lord, thank you for giving us light about how we can take better care of our bodies. Help us so that we may be able to empower our patients, our clients, our family, our friends, that they can also live a healthy life. And help us to always remember that the goal of health is so that we can better serve you with our bodies and our minds. So give us clarity of mind. And if there anybody in this group who is having trouble with temptation, I've asked you that you'll help them and deliver them from their habits, whether it's drinking or smoking or giving up dietary issues or physical inactivity, that you'll give them strength, because we know that we can do all things through you. So thank you so much for Jesus, for a sacrifice which enables us to have power. In Jesus' name we pray, amen.